Hey Madison, I'm JD. I'm going to be your physical therapist this afternoon. How you feeling?
Not too great.
I know. Unfortunately, the hospital is not the best place, right? We really make it hard for the patient. Like you don't get enough sleep.
Oh,
The food
right.
really is terrible here in Grady. I heard they don't give you anything that's really like to sustain you. But do you remember you got admitted for a hip replacement yesterday? So I got a referral that you had a hip surgery on the right side. They call it posterior, so that means the incision is right here. You probably feel that you had some pain in that area of the incision, but I'm gonna check on it later. Doctor wrote down a hip precaution. You probably forgot about that before the surgery, right? Let me do this. I want you to take it next. So do you remember them?
I think so.
Can you tell me?
I know I
Three
can't
things.
bend, and I can't lift very much.
Yep.
And I shouldn't twist.
That's wrong. That's just my precaution.
Oh God, sorry.
You had a hip surgery. So the precaution is there are three things, all right? You cannot flex up to 90 degrees. You cannot twist pigeon toes because that's gonna dislocate.
Oh,
Yeah. Yep. So moving it in, and then at the same time you cannot like move it towards past the midline. So those three things are important and necessary for you to follow for the for the hip to stay in place. All right? Can you repeat that for me?
I can't bend more than 90 degrees.
Flex the hip over 90. Yep.
I can't move my leg past midline or
Mhm.
past midline.
Yep.
And I can't pigeon toe or anything.
Oh, don't do that there, right? So those are common with the patient, or make sure they don't do that, all right? Do you know why you have this pillow in between your legs?
Keep me from crossing.
Most definitely. And at the same time, it's a good congruency position of your hip, all right? I'm gonna remove that later, all right? So the way it's gonna work, and also your weight bearing is tolerated. So I'm getting my walker ready for setup later, so hopefully it's gonna be appropriate for you. It's got wheels. This is gonna be the mode of training for later for you to be able to walk, all right? The way it's gonna work for me to be able to get a good determination of what you can do and you cannot do, I need to perform my vitals first, make sure that you're safe getting out of the bed. We're gonna do our pre-mobility examination. You just check your arms and your legs and your surgical leg to see how much assistance needed. And at the same time, it's gonna help me to determine the best transfer approach for you. All right? That sounds good? If at any point this is creating any pain, please let me know. All right? Any questions for me? All right, we're gonna start with just the vitals, all right? And check your blood pressure. Do you remember your blood pressure reading before?
I do not.
It's normal though, right?
Oh,
Yeah,
yes.
perfect, yeah. Because I look at the chart, everything is within normal limits. It's just me checking, make sure. Can you flex it for me? Just relax. $108/60. That's perfect. Now we're gonna check it again after the walking. Make sure you're tolerating the activities, right? And then just make my pointer. Can you turn your head to the right side for me? So I check your pulse, 64 beats per minute, and then you're going to be able to inhale and exhale. It's also normal. It's 60 breaths per minute. So everything is good, all right? So the first thing that we're going to be doing here first, be wearing underwear today, all right? I'm just going to pull the gauntlet up to see your incision, right? Just pull it
Tripping.
in here. Doesn't appear to be draining anything, right? It's good. You have that good covering there, all right? And I can remove this before we do anything.
You have popcorn, such a nice thing because you just can't get the trash.
First thing I want you to do first, okay, you lift your arms up for me without causing any pain. No problem. And then down. And then all the way arms out to the side towards your head. And then back. Very good. And then flex your elbows first. And then extend them. Very good. And then let's do the range of motion here. Can you bend your hip and knee towards your head? Like that. And then perfect. Can you your left leg out to the side. Very good. And then can you move your ankle, left ankle towards your head, and then towards me. No problem with that, right? And then I'm gonna help you here. Can we do a gentle bending of your hip and your knee? Just slide your heel, just like that. No problem. And then I'm gonna help you here. Can you move your right leg out to the side? Very good. So let's say you have good range of motion. It's expected that your right hip is not moving that much, but that's fine because of the surgical operation, right? So now we're going to be testing your ability to activate your muscles. Can you hold your arms forward this way? Don't let me bring it down. Hold it, hold it, hold it, no problem. And then hold, hold, hold. Are you right-handed or left-handed?
Right.
Can you squeeze my hand for me? So that's good. That means you can squeeze the walker later, right? Flex it for me. Don't let me extend it. Good. Don't let me flex you. And then last but not least, don't let me move your arm in and then out. Very good. And then the same thing, can you flex and extend your wrist for me? Very good, no problem with that, right? Good. And then the same thing here, you can lower your hand down for me. Can you, I'm gonna move your leg towards the whiteboard, don't let me do it. Hold, hold, hold. I'm gonna move it out this way. Hold, hold, hold. Flex this for me. Don't let me extend it. Don't let me flex it. Good. And then don't let me move you up. And don't let me pull your leg down. All right, very good. I'm gonna pretend that your leg is closer and let me just do this, all right? We're checking for any redness or any pain under your calf area. This is be symmetrical, all right? No pain here, right? On the unaffected side, on that surgical side. And then if I put my hand right here, any pain there? Nothing. And then I'm gonna gently move your foot up. No problem. So that is good. It tells us like you're not forming any clot there because being in bed for a while, that could be a factor. So that's cleared for that, all right? And then next thing that I want you to do, right? I want you to put your, I'm gonna put my hand under your knee. Can you activate this muscle we call the quads? Push my hand against the bed.
Push it.
Down, down, yep. And then let go. Push it again. And then don't let me bend it up and don't let me flex it, all right? So a few of the things that we want to do before we get you out of bed for the transfer, we'll give you some exercises first, all right? So the first thing that we did before is like gentle sliding of your heel by flexing your hip and your knee, call that heel slides, and we do 5 reps of that. That causes too much pain. I'm gonna help you. 1, good, 2, 3, 4, and then 5, all right? And then this leg is a stronger leg. Can you do some leg lift for me up to this high? 5 reps. 1, good, 2, good, 3, 4, and then 5. So we have a big muscle at the back of your hip here called the glute max. It's really good for your walking and transfer. Can I be able to put my hand right there because I'm going to do a muscle setting exercise, all right? So I'm going to be putting my hand right here. I want you to squeeze them together, all right? We call that glute setting. Yep, just like that. Hold it for 5 seconds and then let go. Hold again. 1, 2, 3, 4, 5, and let go. And let's do another one. And let go. So you have heel slides. You can do your leg lifts there. And then your muscle setting, your glute setting. Those are the 3 exercises I want you to concentrate and then we can progress it more. Any question? And then last but not least, I'm gonna remove your sock here, all right? That's okay. Can you close your eyes for me, please? I'm gonna move your big toe. Tell me if it's towards the door or towards your head, all right?
Door. Door. Head.
Very good. Open your eyes. Just checking your pulse here. That seems to be good. And perfect. So while you're laying down there, did you use a walker before at home?
No.
Yeah. So I'm gonna show you how to use them. It's pretty easy, all right? And it's easier while you're very stable there. Very good. I'm gonna put this too. Have the same juice.
I'm so sleepy.
The only problem feel like it's always
You need a
hard to.
nap.
So technically, that's gonna hurt the patient, right?
I know.
So,
I'm like,
so you're back to painful again. Yeah. So this one, that's why I just like the socks, but we'll figure out something in the practical whenever he says, so maybe wear something looser. Yeah.
where's my hubs? Okay.
Yeah.
I think we're
It's the hardest thing.
Honestly.
So I asked the nurse, they
Crocs.
said they're gonna come here, we just clumped it, alright, so we just pretend that's clamp, alright? So the nursing did that for us. And then your breathing seems to be okay, so we could, the nursing said we could disconnect it as well, alright? Then we'll measure you with the walker, just make it easier. You're not getting choked up, right? That'll be bad. And we'll fix that later for you, right? So I'm just gonna be lining this up for us. Can you move this leg in and out for me? Not this way. Rotate them in and then out. One more. Perfect. So it looks like that's a good height for us. So can you see me here? So we're getting up in a standing position, right? God bless you. See my back foot here, the back of the walker, right? So you need to stay there. I don't want you to be too far forward or too far back, all right? So the whole purpose of this is for you to just feel it. So do not lift them, right? So you're gonna move the walker forward, surgical leg, which is a right leg forward, and then left leg. All right, so walker, right, and then left. As I mentioned before at the beginning, you can put as much pressure as you can, and that's gonna be dictated by how much pain you're experiencing with your hip, all right? Can you repeat the pattern for me?
So I'm gonna move the walker a little forward, and I'm gonna move my right side and my left side.
Perfect. And then everything is connected here. We're gonna leave that in your leg, right? So the easiest way for us to transfer you out of bed is by a long sit, all right? So the way it's gonna work, your core muscles are working before, right? And you should be able to like help you and your whole upper body is working real well. You can get up in a long sit position, all right? And then when we do that, from a long sit position, I'm gonna help you with your surgical leg. I'm gonna pivot you towards your front knee, all right? And then when we do that, I'm gonna put your gate belt as a support system for us, all right? Questions for the transfer? You ready? I'm gonna hold you right here at the count of 3, contract your abs, and then use your arms. Come up. 1, 2, 3, up. You're not getting dizzy, right? Feeling okay? All right? They're not gonna be smiling like this in the hospital setting. They're gonna get really pain. Okay, you can help me move this leg up all the way, pivot, and I'm gonna help you lower this leg, right? I'll fix that for you. So let's just pretend that the nearest thing
My
is
nap
like that.
every few
I'm
minutes.
gonna put that back in again. This is the gate bolt, security for us, right? Very good. That feels okay? And then I'm gonna set up the chair for you there later, all right? It's gonna be need to be higher because we don't wanna violate your precaution, all right? Then stay there. So the way it's gonna work, right? You're gonna push from the bed. I don't want you to move your trunk too far forward, right? Because that's also violating your precaution. And as soon as you get up, you're gonna hold it to the handrail, the walker. Count of 3. 1, 2, 3, up. Perfect. And you can move that leg up, and then we're gonna walk towards that door. The pivot. Right leg forward, and then back. All the way. Just watch that outlet there. And make sure you're relaxing your upper back, all right, and your neck. Okay? Okay? So you're seeing this chair right here, right? I'm gonna want you to work your way that way. Turn yourself to the left. Start turning this way. Yep. That way. I'm gonna want you to feel the back of the chair before you sit. And then before you sit, I need you to kick the surgical leg forward, right? Without causing too much discomfort or pain. So kick your right leg forward first. Reach with your left hand. And then the right hand. And then I'm gonna help you go down. And then just reach back, right? You can lower that leg for me. Are you comfortable? I'm just gonna grab, I have somebody guarding you. Let me check your blood pressure again. And then your pulse. .110 over 70.
Ah, dang it, I can't even, hold on.
So
Let me see if I can.
The timer. Check your pulse for another 30 seconds. Beats per minute. I did it like half the time. That's perfect. You responded well to the therapy. All right. So I'm gonna have the nursing put back your IV. All right. We're gonna reconnect your
That's 20.
oxygen in the tank. Make sure you have a good. So that we did that. And then we got the IV back. All right.
Subjective.
And then you're pretty stable here, right? Feel comfortable, all right? Can you remind me your expectation when they're gonna walk you there, when you have to go to the bathroom with the walker?
Getting up or
Going to the bathroom, how are you gonna use the walker? If
Yeah.
you need to go later, because I'm gonna clear you if you go to the bathroom now, yeah?
I'm just supposed to walk over forward and
Yep.
then my right leg into it and my left leg.
Perfect. And then you are not allowed to go by yourself. That's expected, right? I think you just didn't help. But probably a day or two, all right? So I have the call bell next to you, right?
Period.
So I
Ding,
want
ding,
you to call the nurse if you needed them. There's your call bell, right? You just ring that if you need something, right? And then what are the 3 exercises we're giving you? In bed before. They could do again later, right? Because you're gonna go to bed later. 3 things, what are those?
With the elbows,
Mhm.
and then one leg up on the left side.
Yep.
And then I'm gonna do like the, what do you call it?
Glute squeeze, yeah, muscle squeeze, yeah, of your walking muscle, yeah. You just hold it for 5 seconds. I'm gonna write that down for you and then we need a piece of paper for that as well. I'm gonna put my number at the whiteboard. If you need it, we're gonna see you again tomorrow morning because our goal is for you to get you as sooner as possible because I can tell already you sleep deprived. Probably not the best place for recovery process, unfortunately, but we're trying our best to like get you the most as safe as possible. All right? Any questions for me? And then I want you to stay in your chair, so just again as I mentioned before, because it's better than laying down because your heart and your lungs are working properly. And you can just watch your TV and play with your phone. That's fine too, right? So I mentioned before, all those there, whatever you need, just let me know. Yep. Questions for me? Nice work, Eddie. Yeah.
Thank you.
You did amazing. Yeah. Yeah. You're welcome. Yeah. How long?